Okay, well, good morning, everyone. Welcome to our monthly community conversation that here we are focusing on folks from Wellington, Waverly, and Buckeye. This is a virtual meeting, of course. At the last meeting a month ago, one of the topics was related to COVID-19 and how the county's doing from the health department perspective. And certainly there were questions and issues raised about the Poudre School District and what the school district is doing to make sure that we're keeping kids and teachers safe and staff, and of course, most importantly, learning. So I have invited folks from the health department. We have Tom Gonzales. We have folks from the Poudre School District, and they can introduce themselves in a moment. So that's the focus of our discussion today. Very quickly, before I turn it over to Michelle, our format will be, and our sequence will be that once Michelle explains again about the platform and how to ask questions and all of that, I will give a very brief update on the county's long-term recovery efforts, how we're looking to spend some of our COVID-19 relief funds. And then I will turn it over to Tom Gonzales, who can give us an update on what's happening from the county perspective. And then we'll turn it over, I presume, to Dr. Smyser from the not from the health department, from the Poudre School District, and there are some other folks from the school district, and then we'll open it up to Q&A. The next meeting, I think, is scheduled for October 1st. We haven't determined if that's going to be in person or perhaps do the Zoom meeting format, but you'll recall from the last meeting, the request was that we have people come from our solid waste department to talk about the Wellington landfill up north of Wellington. Thank you. Michelle, your turn.
Thank you, Commissioner. Good morning, everybody. My name is Michelle Bird. I'm the Public Affairs Director for Larimer County. And my role today is to be kind of your Zoom host. So that means I'm part IT, part moderator. But a few things for those of us who haven't joined us regularly. You'll notice that this platform is a little bit different than maybe what you're used to in a Zoom meeting. This is actually a Zoom webinar. And the reason we use a Zoom webinar is really for safety reasons. I'm sure you've heard about Zoom bombings and things like that occurred early in this virtual COVID world that we're living in. But the Zoom webinar keeps us all safe in two different ways. One, you'll notice that chat function you normally have isn't enabled. That keeps participants that we don't know from coming in and sending a link out to all the other participants that may put a virus in your computer, that may send you to a website you don't want to go to. And the second reason is you'll notice all you can see in terms of faces are the panelists. Again, that's to allow participants to join us, but not necessarily show something on their screen that they shouldn't be showing. So that's why we use this webinar function, but we think it's actually a good tool as well for participation. So there's a lot of different ways you can participate today. First, there is a raise hand feature. If you are on the Zoom app, either on your phone or on a desktop, you should be able to raise your hand, and that will indicate to me that you want to speak. Once it's your turn, I will say your name and let you know that I have given you permissions to speak, and you'll have to unmute yourself in order to speak. Typically, the unmute button is going to be in your bottom left-hand corner. Also, you'll notice there's a Q&A button as well. So if you have questions that you'd feel more comfortable typing in, go ahead and type in your questions and we'll get to those as well. I know there's no chat box, and I know a lot of people like to kind of have a running commentary. They like to give opinions as we're going, and I want you to know that you're more than welcome to put your opinions in that Q&A, and I'll just make those live as you send them in. We won't necessarily address comments if they're not questions, but we want you to know that we're hearing what you're saying, and we want to get your voice out there. One thing I might use the chat box. Now I can use a chat box, and I might use it to I'll send links to you guys for websites that folks talk about here in our presentation. If you have called in, so you're on your phone and you dialed the number to call in, you can still participate as well. What you need to do to let me know you'd like to talk is just hit *9, and that'll let me know that you want to talk to us. And when it gets to be your turn, I'll walk you through how to unmute yourself. And I think Commissioner Kefalas may have already said this, but I'll let everybody know again. Our plan for this morning's session is to let our guests speak, and then we'll get to the Q&A part. However, as you have questions that come up as our guests are speaking, please go ahead and you can put that in the Q&A function so you don't forget about them. And we'll get to that a little bit later, as well as if you know you have something to say, you can raise your hand now. And when we get to that participation part of the morning, we will jump in there. So that is all I have, Commissioner.
Thank you, Michelle. And I noticed that one of the attendees is Dr. Chris Urbina. Could you change him to a panelist? Because I think that's the intent. He's one of the folks from our health department.
I will do.
And before I get into a brief overview of our long-term recovery efforts, our collaborative, I would like to respectfully ask if the folks could introduce themselves. We'll start with Dr. Smyser, please.
Hello, everyone. I'm really happy to have this opportunity to try to address your questions. I have some really smart, talented staff with me to help with that as well. And I hope you'll feel like you were heard and you have a chance to listen to the people that you need to hear from.
Thank you, Sandra. Chris, would you introduce yourself, sir?
Sure, I'm Chris Urbina. I'm the medical officer for Larimer County Public Health.
Great, and moving to Tom?
Yes, good morning, everyone. Thanks for having me. Tom Gonzales, Larimer County Public Health Director. I'm glad to be here to answer any questions.
Thank you, sir. And I believe that's Madeline. Hey, Madeline.
Good morning, everyone. I'm Madeline Noblett, the Executive Director of Communications for Poudre School District.
And moving to the third row, Matt.
Good morning, everybody. Thanks for having us here. My name is Matt Bryant. I'm the Executive Director of Operations for Poudre School District.
Great. And finally, Katie, please.
Hi, everyone. This is Katie O'Donnell. I oversee communications for the Larimer County Health Department.
Great. Thank you all very much for taking time. I know time is a valuable commodity these days, and everyone's working really hard. So as I said, let me just take a minute or two to talk about the county's efforts regarding COVID-19 relief funding. Some of you may know that there were some federal dollars. Some of that went to the local jurisdictions. Larimer County, I think overall received about $35 million. 15.3 million of that is going to the county directly. Approximately 9 million is going to the city of Fort Collins. So it's being distributed to the county and the various municipalities and local jurisdictions. In terms of the county, with that 15.3 million, some of how that money will be used will be to support community efforts. And the three main categories that we're looking at are helping with business supports, essential needs, community outreach, and actually there's a fourth one dealing with IT support. So we've, with regard to economic recovery and business support, overall we're looking at distributing about $2.4 or $2.5 million. About $835,000 of that, or 34%, would go for various activities like small business support loans in the economic recovery business support area. The next area, essential needs, we're looking at about 1.2 million going for that. And some of the areas there include food security, addressing people's food security needs, rental assistance, childcare, and some homeless support funds. And that represents about 50% of the monies that we want to distribute to the community. The third area is community outreach and engagement. So making sure that we're targeting, especially areas that are sometimes overlooked, to provide the information that they need and do some other supports to make sure that folks are safe and being able to respond as families, as businesses, to the COVID-19 situation. And then finally, with regard to infrastructure, we are looking at putting some money towards IT work, and we're looking at a couple of different dollar amounts, and we've been working with the school district to try to support their efforts around getting, the adequate IT support so the kids can do the virtual learning. So that's my overview of the COVID-19 relief funding. The good news is that we have submitted application to the Department of Local Affairs. They're the ones that are administering these funds, and these have to be COVID-19 reimbursable expenses. And we've received approval that the first $3 million will be coming in very soon, if not already. And then that money is intended to go out to some of these community needs. Thank you. With that, if folks have questions, again, they could ask that afterwards about this. But with that, I think I'll turn it over to Tom Gonzales and the health department folks, and they can enlighten us about our efforts to keep people safe.
Good morning. Thank you, Commissioner Kefalas. Appreciate you having me on.
Yes.
Sorry, I was getting an echo there. There, it went away. Good. Again, Tom Gonzales, Larimer County Public Health Director. Right off the bat, I want to let everyone know I know there are a lot of questions and uncertainty, and this is unprecedented. We are changing and adapting our response as the situation changes. And I do appreciate everyone's patience and flexibility during this time. This isn't just a Larimer County issue nor a Colorado issue. It's a national and global issue. And we're just taking the best guidance we get from the Centers for Disease Control and the Colorado Department of Public Health and Environment. We'll talk a little bit about that real quick here with the presentation. And then I do have our medical officer, Dr. Urbina, who has many years of public health medical experience. And he serves as the medical director for Pueblo, Larimer, Boulder, as well as Pueblo. So he's got a regional perspective. And then Katie O'Donnell from our communications standpoint, and she's been working closely with many of our industries, including our school districts. But when people ask, well, what data are we following? Our data is all on our dashboard. Our county IT has done a very good job of putting together what we call our COVID-19 dashboard, and that's larimer.org. Up at the top page, you've probably all seen it. Click on COVID-19 and get the data. That's where we put all the data in different formats, but it isn't one set or indicator that we're following. There's actually a variety of different indicators that we're looking at to determine the status and health of our community when it comes to COVID-19. And I'll jump on the dashboard real quick and just briefly go over it. But there's 3 indicators that the state of Colorado's health department is asking us to follow and us to be at certain levels. You may remember early on in May, we applied for a variance to Safer at Home to allow us to expand in some capacities. And we were granted that variance because at the time, our incident rate was rather low. Well, we had an uptick in the middle of July, which that initiated a letter from the state health department indicating we needed to put a mitigation plan together with our community and to try to get those numbers down. I'm gonna just say, so proud of Larimer County. Keep NOCO Open is the campaign. That was the mitigation plan. Our chambers are involved, our Economic Workforce Development Center, many of our businesses, our municipalities, our school districts, everybody's putting in a hand and helping out. But what happened was in July, our case rate, that's the number of cases per 100,000, it's a formula we use, 14-day period, went up. It went up to almost 100 cases per 100,000. And that's what initiated the letter from the state. Since then, we've slowly been declining to where today we are at 68 per 100,000. That's a good number. It starts slowing down and we appreciate all the good work. Many of our cases back in July were linked back to large gatherings. And that's a process we call contact tracing. When we get a positive case, we have several staff, epidemiologists, public health professionals that call and try to determine where that person was exposed and then determine if any other people may have been exposed. And then we discuss it with them to make sure we're not continuing community-wide spread. That's one indicator. Another indicator that's very important to the state health department is our percent positivity with tests. And we've been very low from the very beginning since March 9th. Our percent positivity has always been below 5% for the most part, except early on when we didn't have much testing, but of recent. And that is good because that's another indicator. We can't go over 5%. Today, over the last 14 days, we've been at 2.8%. That's great. That's the lowest the number's been. And overall, we're at about 3.5%. So we've been relatively low there, and the state has recognized that and has allowed us to keep our variance based upon that. So that's something that's very, very good. Also, they want to look at our hospital capacity and health. So we have a couple indicators on our website. We look at the number of admissions to the hospital that are COVID-19, the number of people that have been treated and recovering, and then we look at ICU capacity. And recently, ICU capacity did pop up to 80%. That's kind of a yellow indicator. But talking with our hospitals, they're telling me this is trauma season, that they're getting many people in there from accidents, not really COVID-19 related. We only have 5 patients currently in the hospital. To give you a perspective, back in March and April, we had nearly 60 people being treated in our hospitals for COVID-19. So much different. The curve drastically came down with all the sacrifices that we all made. But back in March and April, the hospitals were at capacity with treating COVID-19 patients and couldn't treat regular, just day-to-day emergencies such as a heart attack or a car accident. So those are the parameters that we look at. Now, there's a lot of other data on our website, and certainly if you haven't seen it, please take a look at it. If you haven't, you have questions, please let us know, because we want to make sure you understand the parameters that we're looking at. That's with the data. Now I want to talk about something that's really exciting, and that's testing. When I talk about COVID-19 testing, and certainly Dr. Urbina has a lot more knowledge than I do when it comes to the actual specific testing, but there's 2 pieces to it. There's the sample collection. That's the swab that goes in the nasal cavity. That's the collection device. That's one piece. How much can we gather there? Then that has to go to a clinical lab, where the clinical lab runs the test. It's called a PCR test to determine if there is virus on it. Well, early on in the pandemic, we really didn't have capacity for either. We weren't built for that. Our laboratories, our swabbing devices, there was supply chain issues, so we could barely do 30 a day. Well, now, with the partnership with UC Health, Banner Health, Kaiser Permanente, Salud Family Centers in Fort Collins, and Estes Park, and then our community-wide testing that we do in Fort Collins and Loveland 3 days a week, we can swab or specimen collect up to 1,500 a day. And that we started really putting together in May, and that was a big monumental move. That was huge, going from 30 to 15. And that was significant, and that helped us with our contact tracing, and that got our rates, helped us get our rates down in June. Well, then in July, we had a real big uptick statewide on samples being sent to all the clinical labs, including the state lab. So now we had a backlog at the labs. We got all the swab, people could get the swabs, but they were sitting in the lab for up to 7 to 10 days, really compounding our efforts to contact trace. So look, for example, let's say I'm potentially exposed Tuesday to somebody that had COVID-19. I was within the 6-foot bubble for more than 15 minutes. That person has symptoms, they get tested on that same day, Tuesday. If it takes 7 days to get results, health department staff aren't calling me till the following Tuesday to tell me that I may have been exposed. At that time, I may have visited my parents. I may have went out until a gathering. I don't know, and I may have exposed other people because I did not know. So 7 days is just unacceptable. Our goal is less than 2 days, and we can handle 3 days. But if I knew about it Thursday or Friday, then I could take quarantine precautions and slow the spread of the virus. That's the same thing within our schools, as we were having conversations back in July with contact tracing. But I've got good news now, because the state health department added a 3rd shift to their lab. They're running samples 24/7. They're working with us on any overflow samples are going to a private lab in Denver. And we're working with Colorado State University's research lab, toe to toe, hand to hand, on getting their lab ramped up, so they can continue to take overflow and take our samples, and they've guaranteed us a 2-day, 20 or 48 hour or less turnaround. So with all that now, our test results back in July, that only about 30% were coming back 2 days. Many were taking way more than 4 days, up to 40%. That's completely flipped. Now our results are coming in 70% or 2 days or less. 3 days are all the way up to 90% or less, and we only have a couple outliers. So we shared that with the school districts yesterday and sent out a media release, that the exciting news that not only our specimen collection, but our testing turnaround times have drastically changed, and we now can do effective contact tracing. So I wanted to share that good news with you, and that, Commissioner, was my presentation.
John, you're still muted.
You would think by now we have that figured out. I will repeat my question. Chris, is there anything you wish to add briefly to what Tom just said before we turn it over to the school district folks?
No, John, thank you for the opportunity to come and participate. I think I'll go ahead and wait for the questions and then handle those at that time. Thank you.
Thank you, sir. Sandra, would you like to lead the presentation from the school district?
Sure, I'd be happy to.
Thank you.
I am so thankful for the news that we got as a community yesterday. Thank you all in the health department for your hard work. And I know that you're not usually the superstars of the community, and you do your hard work, and most people don't know what you're doing, but boy, are we relying on you these days. We're so glad that you're there and you have the expertise to lead us through this. I am encouraged at the worst case scenario. Hopefully we'll be able to open on our target date for opening, and we'll just see over the next few weeks if it's possible to move that date forward or not. We'll just have to wait and see. I know that one thing that happens is community spread, and we'll have to just see if our community continues to do everything they can to limit the spread of the virus to keep the numbers down. We know that when we do open, which will be someday, we will contribute to spreading. I mean, I think that is the expectation, is that we will contribute to spreading. If you look around the schools that have opened, you do see cases and people being quarantined, and at least the system to handle that when it happens appears to have all of its pieces in place right now, which is very exciting news. Madeline, I'll turn it over to you.
All right. Good morning, everyone. I'll share just an overview of how things have gone since we did open on August 24th. One of the things I'd like to say, and I think we all know it on this call, is just how incredible this community is, how challenging things are at this time. We've seen people adapt and come together and still share in some of the joy that we usually see at the start of the school year with welcoming kids and teachers back. And so that's been great to see. A few highlights from our first couple of weeks. Before getting classes underway, there was a massive effort once again to distribute technology to our students to ensure they could access their remote education. So distribution of laptops and Chromebooks and MiFi internet hotspots to students who don't have reliable internet access in their homes. And so we will have distributed right around 30,000 devices. And then our board just approved about $3.5 million in spending on technology as well, which would include those MiFi devices and some of the other Chromebooks and things like that. And we'll be doing some upgraded new technology to some of our younger students, but they did start out the year with that technology as gathered from all of our classrooms. We're very fortunate in PSD to have had a prior bond and milliview override approved by voters, so that we have a strong one-to-one technology program in the school district. I would also say that we saw just great compliance and effort by our families coming in for the very limited introductions to their teachers. So at the elementary level, for example, parents and students were able to come in for just a short amount of time so that they could meet their person face-to-face. Because when we went into remote education in the spring, everyone knew each other already. But one of the challenges we had this year was, how do we make sure that our teachers, our staff, and our students forge those really important, strong connections? And so we were able to do that again, working with Tom and Katie and the great team at the health department to make sure that those interactions were done in the safest manner possible, bringing people in for short periods of time to meet their teacher, set up their laptop, make sure that they could log in, and then importantly, accessing what are called teacher learning pages. So new this year are teacher learning pages that every teacher and or department, more at the secondary level, will have a central, consistent place where families and students will get messages from their teacher, be able to access links to the online learning platforms that they're using, and have access to a whole host of resources. So one other thing I'll emphasize, and then I'll turn it over to my colleague Matt, is this year is all about consistency. We had time to prepare for this in a way that we didn't this spring, that none of us had. And so a few of the things I'd highlight: between spring and summer 2020, our staff and teachers did 20,000 hours, more than 20,000 hours of training in remote education, learning best practices and leaning on the teacher leaders we have in our district who have been doing digital teaching for years. And just some amazing, incredible passion there, making sure they were prepared for kids. And then the second part would be just around expectations. Starting this year with very clear expectations about what families could expect of teachers, what teachers could expect of students. And so we've been working hard to communicate that starting before school and then over the past couple of weeks so that everyone knows how to work together and support kids best in this new world.
I think that's my cue. Good morning again. Thanks for having us. I do just want to echo again our appreciation to the Larimer County folks. Tom and Katie and their staff have just done an outstanding job of supporting us, answering our calls at all hours, and just guiding us through issues as we go through how to clean our buildings, how to transport students, how to feed students, how to. It's just been this massive how-to lesson since March. So just to kind of back up and give you a little history about what we've done, starting in March and April, we knew we were going to need certain items to clean our schools, to keep our staff and our students safe in our buildings. So we began then ordering PPE materials, the personal protective equipment for staff, students, and anybody that enters our building, so that we could supply those. And of course, we entered that about the same time everybody else had that light bulb go off in their head too. So we had this global competition for supplies. We do have lots of supplies on hand. We continue to order supplies. We continue to supply basic PPE, and then above and beyond PPE. We've got isolation centers that we can put up when needed in the schools. We have bought special equipment to clean restrooms that will cut down on the cleaning time, but also clean them to a high level of sanitation. We're making sure that we have plenty of sanitation in every room. We've trained staff on how to use those sanitation materials. We've provided guidelines on how to return to work. Our IT staff did a great job, and I think Madeline's team was part of this as well, and our HR team putting together a daily check for staff when they come to work. It's an app that they have on their phone or on their computer. They get on, they go through the checklist, and they give us that self-check to make sure they're safe coming in our buildings. Because right now we do have staff in our buildings. Many of our teachers have chosen to teach from their classrooms. So we have our buildings open. We have to be conscientious about our air handling and what does that look like, our filtration systems, and how we're providing that clean air to staff while they're in there. And of course the PPE, some of the specialized PPE is what you see around town with plexiglass barriers for staff for when students come back. So we're not only planning for what we're doing now, but we're planning for what we're going to do when we reopen, because that's our number one goal, is to get kids back in these classrooms as soon as possible and start one-on-one learning again. I think everybody is looking forward to that day. So we're working on that. We're still buying a lot of PPE and looking at what needs are. It seems like every week there's something new that comes up. And with Tom and his staff, we work with them and say, hey, is this something that we need to look at? Is this something that would benefit or be useful for us? And it's been great to have that teamwork with them to develop those things. Cleaning guidelines, we've developed cleaning guidelines above and beyond what we normally do. Our cleaning before COVID was very adequate for this virus, but we've stepped it up. We do clean more often, and we have hand sanitizers stations in all the buildings. We're providing, like I said, special equipment to clean restrooms and things like that. Our air handling filtration systems have been upgraded to be prepared for that when we have students come back. One of the biggest things we had to figure out early on in March too was, we have 30,000 students that need to eat. How do we feed these students? So over the summer, we had feeding locations that we developed. That staff was trained on how to handle food. If you had a chance to see any of those sites, there were some in Wellington as well as in Fort Collins and Timnath. A car would pull up, say how many meals they need. A child nutrition worker would put the meals on a table. A car would pull up to the table, and then they take the meals off the table. There was no hand delivery in that. We were all kind of hands off as much as possible. That seemed to work well. We didn't have any problems at any of our sites. Now that we are back to school and doing remote learning, feeding is even more critical. That we get these kids fed a lunch and a breakfast. We've got about 30 some odd feeding sites around town, maybe even a little bit more than that. Yesterday, our numbers jumped up to about 3,000 meals served, and those numbers are continuing to grow. We're thankful that the USDA changed the rule to where we can feed kids without having to track them. Anybody that comes for a meal can get a meal if they're 18 years and younger. And that's made it a lot easier and a lot more available to a lot of students. So we're seeing those feeding numbers grow. We're delivering a lot of those meals by bus to certain locations around town. Those meal sites are staffed not only with a bus driver to get the meals to the students, but also a trained child nutrition worker for food handling purposes. And they're very careful again about how they pass that meal off to the students. So that's been an exciting thing to do that. As we look forward to reopening, of course, transportation is a topic that we continue to have about how many students on a bus that we can put on there. We want to service as many students that need transportation. We did do a registration, I believe back in June, to determine who would need transportation when we open in August. So we do have that list. We're still working on those routes to develop routes and try to provide as many seats as possible. But we are going to have limitations, of course, when we go back. We're still seeing that. So we can't pack the buses with 70 kids like we normally do. We're going to have to significantly decrease that. But we have a great routing department, a great transportation department that's working hard to figure out how to get the students that really need it taken care of. I think that's about all I have, and I'm willing to take any questions and answer anything that we have.
Actually, Matt, would you describe the what a classroom like as we're preparing to come back? What changes have been made physically in the school buildings themselves to keep social distancing and hallways? Sure. And just help people imagine what it's going to look like when kids are back in the building.
That's a great question. I appreciate you reminding me of that. So to begin with, we're going to have lots of signage. When you go to sites now, when you go to restaurants and stores, you see tape on the ground or you see signs on the ground. Madeline and her communications team, along with some others in the district, have developed signage that's going to be standardized throughout the district. We'll have the big circles on the ground, welcoming you to our buildings, and then having that 6-foot distance marked off. You can imagine with 500 elementary kids, it's going to be a little bit like herding cats there, trying to figure out that social distance going in and out of buildings. But we're going to do our best to have things cleared out in the hallways, cleared out in the classrooms, so that there's more room. A typical classroom would have many desks and probably a reading center and other tables, that teachers need in order to have breakout groups and things like little small libraries in their classrooms. Those type of items are probably going to change quite a bit because we want to get that social distancing in each one of our rooms. Our planning department has gone through all the floor plans in our district and has looked at the sizes of each classroom and has tried to lay out what those classrooms could look like with the distancing rules and how many students per classroom that will have. In that classroom, there'll be hand sanitizer that classroom will get sanitized all day long, really, because the teacher has the ability to sanitize as they go through their day. But it'll also be sanitized by custodial services before and after school, during the evenings when the school's out. So the cleaning will be done that way. One of our biggest things is bathrooms. You know, when you've got a classroom of, let's say, 10 kids, if we only bring in the 10 kids at a time, we still have 200 kids in the building that are going to be using bathrooms. And so how do we do the bathrooms? You know, we're going to have to control that very carefully, and the bathrooms will be marked and signed, and schools are developing their process by which they take the kids to bathrooms. But, you know, nobody, a lot of people have struggled to use the bathroom on a schedule. So there'll always be those one-offs and those two-offs. So we'll have to monitor those bathrooms really closely as teachers send their kids to the restrooms. And then how do we clean those restrooms? And like I said, we've purchased special equipment to do that for each building. And that's going to make that process a lot smoother and a lot more efficient. Also in classrooms, teachers will have, of course, all their PPE equipment. They're also going to have the plexiglass shields to where they can do, you know, we know how important one-on-one work is, and teachers want to be able to still do that. So they'll have the ability to set up a barrier area to where they can not only have their mask on, the student have their mask on, but they'll have a physical barrier between, but it'll still allow them to have that eye contact and that personal experience, that one-on-one experience. So still looking at all sorts of ideas that come through. Teachers are very creative people, and they're constantly coming up with ideas that say, hey, can we do this? Can we do that? And when we look at them, and if we can do it, if we can stay within code and things like that, then we look at putting those processes in place. We're also working with our state fire marshal on fire evacuations. We're required to do monthly fire evacuations. A lot of our two-story buildings, you can imagine if we sound the alarm and we empty 30 classrooms into the hallways to do a fire evacuation, we're going to have a hard time maintaining that social distancing. So we've proposed a plan on how to do that differently, but still meet the requirements and still meet the need for these students and staff to have that training, so that if we do have an actual fire, we will know where we're going and how we're getting out of the buildings. So we're looking forward to working with the State Fire Marshal's office on that. I think, again, just signage in the hallways, signage in the classroom, playgrounds, how we schedule playground use within the schools. That's all being worked on and should be worked out by the time school starts. Most of that's scheduling internally at each school. Each school will determine how they're going to schedule that out. But as far as supplying the PPE, the sanitizer, and the equipment, we've been able to work with our finance department and our procurement department and finding the items that we need, and then working with Larimer Health to see if that's appropriate and if that's meets the needs of social distancing and keeping everybody safe.
And where's all the extra furniture?
Dr. Smyser's office is going to be full of all sorts of furniture, tables and chairs. Yeah, so as we remove things, you know, I think teachers and schools are looking at, you know, am I going to use desk? Am I going to use tables? Some teachers like tables. But it's easier to social distance with a desk because we can separate that. So they may have to change to desks. So we'll take their tables. We're developing some storage areas where we can safely store that for later on when life gets back to normal, and we can get that back. But yeah, storage of things that we remove from classrooms is a big deal. And if you know a teacher, more than likely they've got books and they've got a reading center, especially if they're in elementary, in there, and they may have to pack that up, and we want to make sure that's all stored safely and away for them. So that's a good point, is space can be a little crowded when we're trying to move things around like that.
I think one of the key ideas as you picture a classroom in the hallway is how difficult, if not impossible, it will be to have all students in at once. It's just physically, it's 30,000 kids in 52 buildings, and that's the social distancing is the big struggle. And that's where we can't thank Health Department enough, because they have been with us, alongside us all the way, looking at our plans, making suggestions, saying, no, that's not going to work. What are you going to do about this? And so I know the families really, really need us to open up. But opening up with everyone at once, I just don't see how we can do it anytime soon. It's very, very frustrating.
So thank you, Matt, Sandra, Madeline from the school district. Before we turn it over to Michelle, there are at least a few questions in the Q&A. I just wanted to mention something, since we're talking about children. Earlier, when I talked about some of the distribution of COVID-19 relief funds through the Larimer Recovery Collaborative, remember that's a public-private collaboration that was set up last spring when COVID-19 hit upon Larimer County and the state and the country and the world. And the goal is to have people work together to look at short-term unmet needs and certainly long-term recovery. But in the child care department, in the essential needs, we've determined that we would be distributing $540,000 through the Early Childhood Council of Larimer County, and that's to support scholarships and helping people find adequate child care, because we know that's an incredible issue to allow people to go to work and all of that. So please be aware of that. Related to that, another bit of good news is that the Early Childhood Council of Larimer County has just put live a website that if people go to it, it's, I think I have it right, Michelle, larimerchildcare.org, larimerchildcare.org. If you go to that website, you can kind of sign in, but it's a way of helping you based on where you live and that sort of thing, looking at what the options might be for child care to address your child care needs. So please, please be aware of that. Thank you. You're on, Michelle.
Thank you. I'm getting that link so I can send it there in the chat box. But while I'm doing that, we have had some people with their hands up for quite a bit now. So I think we're going to go first to the folks with their hands up. So again, what I'm going to do, I have to give you each permissions to talk. And once I give you those permissions, there should be a mute button that shows up in your bottom left-hand corner. And you're going to have to click that. So Carolyn Reed, you're up first. I did give you permissions to talk and it looks like you got unmuted. So let's cross our fingers and hope this works.
Great, thanks, and good morning to everybody. I'm Carolyn Reed. I'm from the Poudre School District Board of Education. And I think a lot of parents have been curious about when we do get back to school, what will it look like when we have that inevitable outbreak? Like how many children would be infected before we would consider maybe closing that room or that school until we could get control of the virus?
Carolyn, thank you for that question. That's a good question. One thing before I turn it over to Katie, who's been very involved in this aspect, is the Poudre School District has put together a fantastic plan. And there's two pieces to that plan. That's what you heard from Matt at school, how we're going to do the social distancing, how we're going to integrate hand washing into the curriculum with our students, as well as face coverings. Face coverings work to reduce the spread of the respiratory droplets. There isn't one magic number and so forth, but the next part of that plan is what do we do when we get a positive? You're seeing it around the state. We'll get a positive. How do we handle that with cohorting and quarantining? So that's the big piece of the plan. And I'll turn that over to Katie to go over that part of the plan.
Thanks. Yeah, so hi everyone. Now you can see my face, sorry. In transition this morning. So really the biggest thing is we're gonna follow state guidance. And that does change. So I know Tom mentioned the ever-changing world of COVID-19. So there's no difference in kind of how we're gonna be handling outbreaks in our schools. Right now, the setup is that if we'd had, it's a little bit about cases and exposures, right? So what you're seeing in the business community right now is not that the health department is necessarily shutting down businesses because of cases or exposures, but we're having staffing issues because of quarantine and isolation, right? So you have a kiddo who comes in and they test positive. Anyone who's been in contact with that kid or determined to be a close contact would have to be out of the classroom for a certain period of time. Usually that's 14 days. So what you're looking at is some of our schools are choosing to do a virtual option where the kids that are determined to be close contacts are going virtual. Some of them are choosing to put the whole classroom in virtual so all the kids have the same experience. There's a lot of different ways that our schools are looking at that. But what it means is that we'll be closing classrooms, and if we can get to the point where we're closing even less than classrooms and we're keeping really good track of those kiddos and we know exactly where they were and where they sat throughout the whole day, which is a huge lift for our districts and our schools, we'd be looking at even a smaller closure, so not a full classroom closure. Right now, guidance is that full classroom would close, but we are awaiting new guidance that is supposed to be released from the state that we're hoping will change that setup. So the other thing to keep in mind is state has some pretty low thresholds for what an outbreak looks like. Right now, it's just 2 or more cases are considered an outbreak. And I think Dr. Urbina can weigh in on this too. I think it's if you have 3 different classrooms in a school, so 3 unrelated kind of outbreaks as state determines it that happen at the same time, then we'd be looking at a school closure. So we follow those guidance and those parameters pretty closely. And while we do have some local decision making, obviously we do our own contact investigations, we still have to follow the protocols and the guidance given to us by state. So hopefully that answered your question, Carolyn. Let me know if I missed anything.
No, that really helped. Thank you.
Of course.
Okay, thank you, Carolyn, for the question. Steve Sarno is up next, and I know, Steve, you are well in tune to how we do this. It looks like you're unmuted, so go ahead.
Yes, Sam. Good morning. Thank you. John, thanks for putting this together. I appreciate it. My name is Steve Sarno. I'm a native of the state. I've been in this area for about 30 years. I live in the Waverly area. And I'm going to be brief, but I'm going to give a little background because I'd be shocked if everything I didn't bring up or that I brought up importance to every single person in the county. I sent, and then let me preface by saying I have absolutely no question whatsoever to the severity and existence of this disease. None at all. I do question, however, how it's being handled and treated and affected virtually every single person in this county in some an extremely negative way that may be hard for some of you folks to really realize. And I don't mean that in a disrespectful way. I sent some questions to the health department a while back, not just mine. I have so many people I talked to get some answers, because I think one of the biggest issues that people like me have is the lack of information. We're just told, you got to do this, you got to do this, you got to do this, without any justification or reason behind it other than, CDC guidelines. Well, you know what? People want to know more when their lives are being so negatively impacted in some cases, for the rest of their lives. So I'd be happy that I've got a couple sources, and again, I'll be brief, but I think people would really appreciate this. I'd be happy to share this with anybody to know that I'm not making this up. Some of the questions I had to do with some of the decisions that's being made by the county health department. Like, early on, places like Home Depot and Walmart and pot shops and liquor stores were open, but you couldn't go to church, even with the social distancing and measures that could have been done. I mean, that's our right in the Constitution to religion and peaceful assembly. And I know the answer was, statute this and this, the authority. Well, our statutes don't they don't override our Constitution. And I'm so concerned about our loss of freedoms moving forward. One of the other things I asked about was the cure. Is the cure worse than the disease? When you look at the tremendous spike in domestic violence and depression, suicide, divorce, it's a scary thing. And it's a scary thing. And as we reach that point, I think a lot of people have. And the response was, well, the suicide rate in Larimer County has been going up since 2004. And I just thought that was very disingenuous. My main thing I'd like to talk about here is we're always told we base this on CDC guidelines. I sent this to Christophe, is it Fibre? I don't know how to pronounce his last name, the president of the school board, and also the director of the health department. And Christoph just punted it to the health department. Everybody says, and one of the questions that I posed was, you know, everybody says that you always say that you're basing everything on CDC guidelines. I sent you what I'm looking at again, and I would be more than happy to share this with anybody that wants it. This coronavirus disease, the importance of reopening America's schools this fall, importance of reopening schools by the CDC, and this was just in late July. They looked at everything, obviously. When they look at deaths of adolescents under 18 years old, it's 7% with the death rate of 0.1%. And I just would like to read a couple of their conclusions. They say, the available evidence provides reason to believe that in-person schooling is in the best interest of students, particularly in the context of appropriate mitigation measures similar to those implemented at essential workplaces. The best available evidence from countries that have opened schools indicate that COVID-19 poses low risk to school-age children, at least in areas with low community transmission, and suggest that children are unlikely to be major drivers of the spread of virus. Reopening schools creates opportunity to invest in the education, well-being, and future of one of America's greatest assets, our children. Now, I coupled this with the reference from the American Academy of Pediatricians, 67,000 pediatricians, who adamantly say that kids should be in school. And both of these are not in a vacuum. Obviously, precautions have to be taken because there are children, you know, that can have, an underlying medical condition that increase the risk of illness, and you deal with those, and staff, and you deal with those. But to brush everything with a broad paintbrush, I think is extremely harmful. I volunteer at the food bank. I see a lot of these kids, and these are underprivileged kids. I look at them when they come through every other Thursday, and I give them a treat. They say, Mr. Steve, I always say, you keeping up in your schoolwork, blah, blah, blah. And they shake head, and they shake, yeah. And I look at mom, she gives me this depressing no nod. And I think that, no disrespect, I think you folks are so far removed from what's going on out here in the real world that we're losing track of what's going on. So I have two questions, and here's what I'm going to finish off with. You always say that you're basing everything on CDC. Well, right here, and again, I think the health department has this, and I would send it to anybody who would like to see it. And particularly, and I spent a lot of time looking at the 39 different references that they use that say kids should be in school. My question is, why do we say we're using CDC guidelines for mask wearing and social distancing, et cetera, but we're ignoring this recommendation? And number two, I would like to know, this week on Monday, the CDC released brand new data of the percentage of total COVID deaths as it relates to what they actually died from. And what they said is 6%. And I'm not making light of those 6% because it's a tragic loss. But only 6% of the people that have died from COVID died strictly from COVID. The other 94% had respiratory failure, COPD, vascular and unspecified dementia, heart failure, renal failure. What effect does that have moving forward? Because if you look at these three pieces of science, and I'm a science guy, the American Academy of Pediatricians, the CDC, and the most recent data, not only these schools, but our country and county should be open tomorrow and deal with the people at the highest risk instead of having everybody suffer through what has been put through for the last 6 months. Thank you.
Thank you, Steve.
I'll pass it over to the health department folks. Go ahead.
Sorry, Michelle. Thank you, Steve. I'll go after that first question, and Dr. Urbina will answer. He's got the COVID deaths. First, Steve, I appreciate you coming on here and raising these concerns, and I empathize. I'm a father of two middle schoolers in Poudre School District. I hear them upstairs getting to their learning center. Last night, my son broke down. I'm going to be real. This is challenging for them. He's a basketball player. He can't play basketball. I coach his team. My other son, he's struggling too. I do believe kids should be in school. I think it's important. And I'm a big public school proponent. I just wanted you to know that, because I agree, we're all struggling. We're all making sacrifices, and it's very, very difficult. When we talk about the CDC guidelines, there's a piece in that guidelines that talks about being able to test in that part of the plan when you have a positive. That was back in July, when I'll be honest, I was so concerned on our test turnaround times. Our contact tracers, they were struggling to even be able to put this, to do contact tracing. So that was when we talked with the school district. We've been talking with them. We probably talk twice, 3 times a day. I don't know, Katie probably talks daily. It's a great partnership. We shared that concern that we would not be able to do a contact tracing, which is the #1 tool in public health to suppress it. We've been doing it for 100 years. So that was that recommendation from us that, man, this is going to be difficult. And we don't want to put any kiddo or any educator at risk. There are complications from the virus, but I do appreciate that. That's why we work so hard to get our testing turnaround times to where they're at now, that I'm excited. And I agree, this has been very difficult on all of us. But there is a piece in the CDC guidance, as well as the Colorado Department of Public Health and Environment, that talks about when you open up schools, you better take these things into consideration. Now, everything has been, but back in July, the test turning around. Also, what we've done is hired contact tracers, and we're taking our most talented and the ones that have had most experience, and we're assigning them to each of our 3 school districts, our charter schools and our public schools, to build that relationship. So when we do have a positive case, we can immediately, swiftly act. We know people, there's contacts, relationships, so we protect each other. And we certainly are excited about that as well. And then I just wanted to hit a little bit on, you did indicate why certain businesses were picked and not. That was from the state health department. We would have to follow state health department in the office of the governor. I agree. It felt like one business or one activity against another, and it was based on high risk, as we know the virus is spread respiratory. That was difficult. And that's why we want to maintain and keep our variants, because we were one of the first counties to allow more gatherings for our places of worship. I think that's extremely important. And our places of worship have done a fantastic job. So we want to keep that variance so we can continue to be able to have that. And we want to be able to keep moving forward. That's why we keep continuing to get our rates lower. We will be able to expand more. So that's the direction we got from the state health department. And as a community, I couldn't ask for a better community, because there's others that are going the wrong way, and they're losing their variants, and they're losing those rights to congregate. So with that, I want to turn it over to Dr. Urbina to address the COVID death determination.
Sure, Steve. Thank you, Tom. I want to say 2 things before I answer that question. I get a chance to work with a lot of health departments in the state, and I would like to say that Larimer County does an exceptional job of meeting and answering the questions in the community. And 2, I was very impressed with what the schools are doing. As I heard their discussion, it was nice to see they're responding very quickly to the information and the research out there. So let me answer Steve's question. It's a very common question about death certificates. As a physician for over 40 years now, I know it's hard to believe. The idea is, who makes the determination about death? And it's a physician like me, or it's the coroner's office who makes a decision if it's not witnessed or participating in. And that first line is the immediate cause of death. The immediate cause of death. So somebody might die from a pneumonia. Somebody might die from a heart attack. Somebody might die from a pulmonary embolism. That's the immediate cause of death, #1. So a physician like me at the coroner's office is responsible for putting that #1 diagnosis. So what CDC did say is that in that #1 slot, the cause of death was listed as COVID-19. So that's 6% of those cases. But my job in that death certificate is to put the #2 and 3 reasons why that person died from pneumonia or heart attack or pulmonary embolism. And in those cases, in the 2nd and 3rd boxes, for example, let's use a heart attack as an example. My second and third reasons for that person developing a heart attack are generally diabetes, smoking, high blood pressure, elevated cholesterol. So that's fairly common, and that's how we handle death certificates. Now, if you look at the total number of cases, and I think they're now over 185,000, that secondary cause of that final acute event, like a pneumonia or pulmonary embolus, is COVID-19. So that those 185 plus thousand cases either had a primary, 6% of them had COVID-19, there's a number one box, but their second or third boxes was COVID-19. All of those are collected and caused by, and are result in the number of cases that result in cases due to COVID-19. So if I have diabetes, if I have a heart condition, and I get COVID-19, in my father's case, who's 93, he developed COVID-19. He could have died. He did not die, but he could have died from his chronic medical conditions and his age. So the good news is that people do survive COVID-19. The bad news is that a significant number of people in the country have exacerbated their medical conditions and listed in their death certificate as either number one being caused directly by COVID-19, but the majority have been caused as a secondary condition that tipped them over the edge and they died from the disease. And so that's the answer to the issue around death certificates. So it's very puzzling to me that COVID-19, and this is true about influenza or any other infection, is the ultimate cause maybe a exacerbation of their condition, but COVID-19 has caused significant damage in our communities, and hence the recommendations going forward. The final thing I wanted to say is that this is a tragedy for all of us, whether or not it's school-age kids. You know, I have grandkids. I have adults who have lost their jobs, family members, and my father who is sick with COVID-19. We don't take this very lightly. We're all affected by this, and we sympathize with you, Steve, that you're suffering and communities have suffered, and there are unintended consequences like divorce and suicide and depression and opioid use that have been exacerbated by people who are facing COVID-19. And hopefully, as Tom and the health department and the schools all working together, we can reduce the rates of disease in our communities. And in the future, hopefully we'll have a vaccine that we can reduce the infection totally. So thank you for your question, and I look forward to more questions.
Thank you, Steve, and thank you, Tom and Dr. Urbina. We're gonna move on to some other questions right now because we have other folks who have some questions. So Cynthia has her hand up. So Cynthia, I am giving you permissions right now to unmute yourself, and you should be able to go.
Well, thank you very much. And thank you everyone for being here. I know that everybody has worked overtime, so that's appreciated. We're a large family. 5 of my grandchildren are in the school district. I really would like to understand, particularly since they're young, what data is being collected on the family experiences as you've rolled out the synchronous learning and versus the asynchronous learning that was done last spring. And in particular, let me talk about 2 issues that I'm deeply concerned about. One is that when you do synchronous learning and you have multiple ages of children, you are unable to really support both children at the same time. And that's a great concern to me because both of my grandchildren's mothers are terribly frustrated by this. And there's been no effort at this point, I know your hands have been full, to identify what's really happening with trying to do this synchronous learning. The asynchronous allows for rotating between children of different ages. So I hope that you're collecting data. There's been no surveys put out yet that I'm aware of. It would really be helpful for the parents to be able to tell you what's not working. Secondly, I guess I have 3 points. Secondly, I work in educational research. That was my career for many years before I retired. at both the university level and research laboratory. There's a lot of research out there on what happens to the frontal lobe development with this massive screen time. I'm very, very concerned about young children acting like they're on a Zoom call for 5 to 6 hours a day. That really does affect the frontal lobe. There is the light and the flickering and the different things that go on that they note in the research that goes through the eye to the cryptochrome and affects, hormone, a whole cascading of things. So this massive hours of screen time with synchronous, I don't think is very helpful. So I hope that we're really looking at ways to not do so much. You and I wouldn't like to sit on a Zoom call for 6 hours. And I have now all 5 of my grandchildren in my home every single day with the learning coach, because there was no way for the moms to do this with the different age groups and retain their employment. So I am watching this up front. The third thing that I just wanted to say about this synchronous versus asynchronous learning is if we could really have the learning goal objectives given at the beginning of the week, what's most important would really help a lot, because otherwise we're like a catcher in a baseball game. And here comes the pitch from the teacher. Okay, now is it a corner pitch? Is it a straight on? Is it a left? Is it a right? We don't know. And we're reacting to every single direction that's coming from a teacher. And that's most difficult because you just don't know where the next step is. So you don't have a lay of the land, and that would be most helpful. Lastly, I guess I do have 4 points, is the whole issue of IEPs. For the children who have special needs in the IEP, I read what the district put out, and it wasn't very helpful because it was a lot of generalizations, and it's been difficult to understand how these IEPs are really going to be implemented in the home with any substantial impact. And thank you very much. I'm not being critical. I'm raising some serious questions about this asynchronous versus synchronous method that we're trying here. Thank you.
Thank you, Cynthia. Those are very valid and I think very specific questions, and I'm sure our panelists appreciate the specific questions and points. So I'm going to turn it over to our school district partners to go ahead and answer your questions. Madeline's shaking her head, so I feel like I'm going to go to Madeline.
Yeah. All right, Ms. Peck, thank you. Like Michelle said, your questions are very valid. We're hearing them from parents across our district, so thank you for raising them. To answer your first around, are we collecting data to see how things are going? And the answer is yes, of course we are. One of the first and most important places that happens is at the classroom and school level. So principals are working with their teams of teachers and staff to evaluate, and I can tell you honestly every day how things are going and what needs to be adjusted or not. So I don't say this to push you away from myself or Dr. Smyser or Matt, but if you have not already shared some of your concerns around the amount of synchronous learning that has posed a challenge for your family, and specifically your point around clear learning goals and objectives for the week's work, that would be something that I would encourage you to share with your grandkids' teachers as well as principals. And I say that just because they are our incredible boots on the ground. They know your grandkids, they're getting to know them better. They're the ones who are doing that hard work with them every day. So I would suggest, if you haven't already, to have that conversation with, again, either the principal or the teacher, because those are so specific to the learning and remote learning experience. As far as data, bringing that to more of a macro level, there are a number of things that are happening. So first and foremost, in the spring, you'll remember that we didn't do any form of state assessment or anything else. That was all really put on hold as we were thrust into that new world. One of the things that our teams talked about this spring and summer as they were planning was the importance of getting some baseline data to be able to evaluate where our students are today, to be able to evaluate potential learning loss that we know came with remote education in the spring, and more specifically, to figure out where every kiddo is right now so that teachers can, as they are so good at doing, tailor their teaching and their support for each and every one of our kids. They are conducting assessments in many of the grades, both one called Acadience Readings, that's really around reading and language arts, and then one around mathematics, so that they can understand what our kids need to be able to succeed and grow. One of the other things I would add is that, as I said earlier, consistency is key for this year. And so clear expectations, again, of parents, of students, and of teachers, what parents can expect of teachers is important. And so teachers, again, as they're talented at doing, should be giving direct feedback to students every time they're working with them, helping them to understand what proficiency looks like and how to get from the point they're at today to where we hope they can be tomorrow. So that's how I'd address two of those. Screen time, we share a concern, right? I think all of us are in an environment, as adults, of course, given our work, we are subjected to more screen time than many children. But in this new remote world, that's a very difficult and challenging thing for us all to address, because it is, by the nature of what's happening, the situation that we're in. That said, our schools, and again, our super creative, passionate teachers are looking for opportunities to be able to try to help with that. It is tough, though, when we are not bringing all of these big groups of kids together. So there are teachers that I know who do asynchronous PE. And so they're having kids go out and do scavenger hunts in their yard, looking for things that are green, looking for things with spots. They're trying to facilitate these real life experiences that take kids away from the computer, at least for a little while. One of the other things we've heard, you heard Matt Bryant speak earlier about our meals program, and we've actually heard from a number of families who say that they have loved being able to go out and get meals, wear a mask, social distance to get them, but then go and find a spot in the grass and then socially distance from other families and sit and eat a meal together so that they can still have some of those connections. So that's at least an idea we've heard recently from other families. Finally, to your question about IEPs and how we work with our students with disabilities, that is absolutely critical every day in PSD, but especially now. And PSD is working on plans to be able to bring in a very select, small group of students with identified disabilities. And they are very specifically students with disabilities who were not able to engage in remote education. So our integrated services team has put together very strict criteria to be able to identify who these students are. And it wouldn't be bringing them in for remote education, but for support services with our talented integrated services staff to be able to help them continue growth as they move throughout the school year. Those, again, we don't move forward with those plans unless we have the backing of Tom and Katie and their team. So we work very closely, and there is a very strict set of personal protective equipment that they will be using when that takes place. So we'll start with a very small group, and then do know that the integrated services team, they're pretty darn incredible. We have about 3,000 students with IEPs, and they're looking at each one to say, how is it going? What do they need? What does it look like in a remote environment? And then those school-based teams are really the best resource for every student with an IEP, because they know the kids, they know where they're at and what they need. And I rest assured they have done training and done a whole lot of work to make sure to support the kids. And it will look different than it did in the spring.
Thank you, Madeline. And I'm sure that others might have some comments on there, but we have a few other questions I'd like to get to. So if we have time to circle back and others want to comment, we'll do that kind of towards the end. But I want to make sure everyone's questions at least get some attention before we're out of time in about 15 minutes. So next question was actually typed in. So one of our attendees asks, what type of support are teachers receiving during this stressful time? Mental and emotional. I can't imagine how difficult this is from their perspective.
So I can take that one as well, Michelle. Great question, Rebecca. Thanks for asking it. It's something that's always on our mind and something that we know is really important. So I'll break that apart into a couple pieces. So teachers and staff, we are really fortunate in Poudre School District to have access to our employee assistance services. So we are able to get counseling and support from the amazing team, and I can tell you that personally, over there. And that's a benefit that's available to both benefited and non-benefited employees, as well as family members of employees. So it's an inclusive support that's available to us. And we know that teachers and staff are definitely tapping into that. They were prior to COVID and absolutely have continued that now. I will say that there are numerous other things happening in concert with that. Things like our professional learning team, as they have and will continue putting together training and supports. There are classes around building and sustaining resiliency, mindfulness, and just all sorts of the important practices that all of us as humans need to be tapping into to be able to sustain during a time like this. Additionally, I would add that equally important is supporting students, but also their families. And so our mental health services professionals, so those are our mental health coordinators, our psychologists, our counselors, you name them, there's a whole host of them who support, are available to students through their schools. So families can reach out to the administrative team and say, my student has been struggling so much with isolation and depression. I need some help. I need to be able to make sure that they're okay so that they can access their education. And those teams are ready and have already been working. They're also working with students who they were already working with in the spring. So connecting back with them, they already have, or are soon doing so, and saying, you know, how are you doing now? What do you need? What can we do? And this is done in partnership with other mental health organizations in the community, Summit Stone Partners, you name it, there's a whole group of people who are here just for this purpose. We do have more information. I will pop a link in the chat to our mental health resources webpage for the 2021 school year so that you can see more of that, as well as have access to some of those important links and resources. And then another part of that is really helping students' families feel supported as well. So what tools and resources can our teams provide to parents so that they can be supporting their kiddo right alongside our mental health professionals?
Thank you so much, Madeline, and thank you for the question, Rebecca. I have another question. This might need to go back to our health department friends. Lene, hi Lene. Lene asks, I have concerns regarding recent CDC communications encouraging less testing and leaning toward herd immunity behaviors. What guidance is Larimer County offering?
Thank you for the question. I'll turn that over to Dr. Urbina. He's been heavily involved in this.
This is a great question. It's being discussed at the national level a lot. The concern I have about herd immunity, remember this is a relatively new phenomenon as we developed vaccines that can safely increase the immunity of a community by safely giving a vaccine. Not everybody believes in vaccines, but we've been able to essentially eliminate polio, measles, rubella, smallpox, but people don't, of course, remember what that is. So by increasing the level of immunity safely or safer through a vaccine, we've been able to eliminate many of these diseases. Now, the challenge with COVID and suggesting that herd immunity is a solution is that we still don't know a whole lot enough about it to say this is going to be a safe way to do this. We just talked about earlier with some of the questions that we've had over 185,000 deaths related to COVID-19. And not to mention all the other significant issues around cardiomyopathy, this unusual late sequelae for children, the multi-system inflammatory syndrome in children. And we've had between 5 and 10 cases here in Colorado. The long-term effects of allowing people just to go ahead and get infection is not a good strategy. It's not a good strategy. Getting people with a safe vaccine, immunity is a safe strategy. So I think at this point, having that discussion on herd immunity in a quote natural way, allowing people to get the infection is frankly a dangerous strategy. And I would wait till we get a safer vaccine that's effective to make that suggestion going forward.
Thank you, Dr. Urbina. Okay, another question we have from one of our residents is, there was no date provided by Dr. Smyser on the planned reopening that might move up. Is there a move up date, or is that still up in the air, if at all possible?
Thanks for that question. I'm sure that everyone is curious. This is good news. We haven't had a chance to digest it yet and figure out if that would allow us to open earlier or not. At this point in time, the same open date is the open date. Hasn't changed.
Thank you, Doctor. One last question we have here coming from Rebecca. Is there a consistent learning platform like Blackboard being considered to be deployed district-wide? My kids use several different applications and meeting platforms. This would also prepare our students for online college proficiency. I'm guessing that might go to Madeline.
I can take that. So yes, Rebecca, great question. PSD has actually had a contract with Blackboard. I'm not sure exactly how long, but I think it's safe to say years plural. And most often, I believe it's used with secondary students. And so that is something that's been in place. It was prior to COVID. I don't know, honestly, and I would have to check with our Director of Curriculum Instruction and Assessment to see what grades all it's used in, but my best guess and gut is telling me that it's secondary students. But that's something where I can pose the question, and then perhaps if you're willing to share your email address, I can follow up with you and let you know a little bit more about the history of Blackboard and PSD.
And Madeline, I have all those emails, so I can get that to you, absolutely. And one last question here, and I think this will be a quick one. What again is the projected open date? I believe it's October, but I could be wrong.
So what we've said is that we're in a remote education through at least October 16th. That's the end of our first quarter. And as you heard Dr. Smyser say, excuse me, really it's just continuing to process the current conditions. You know, again, we're encouraged by what Tom and Katie have shared around testing results and are still considering what that means for us and whether we might be able to open in person or not. And so we'll be continuing to talk with Tom and Katie's team and evaluate data and look at really what's best for students and families to keep people safe and balance that with the need to learn.
Could I also add, as we do contact tracing, there's another, obviously we need the community to help keep community spread down, and I'll defer to health department on this one, but I do want people to understand as well that sometimes it's not uncommon for people to not cooperate with contact tracing. And I thought maybe Katie could talk or Tom about how important it is to be open about who you've been with, because that whenever we open, it will be a big part of us being able to stay open. And so I just want to throw that out there so people understand how important that is.
Yeah, Dr. Smyser, thank you for that. It is very important work. It's the Answer the Call campaign. And I get it. Hey, we're going to ask questions. Where were you? And we're getting much of our cases lately, over 50% in August, have been the age group of 18 to 24-year-olds. And they don't want to tell us they maybe were at a large gathering, i.e. a party. We are not being punitive. We are not being judgmental. We are trying to determine where the spread is. And so some folks are afraid, and I understand. we're all working with all of our communities to make sure they feel safe to answer those questions. So I'm going to talk to Katie, I'm going to turn it over to Katie. She's hiring some outreach specialists, and one of them is for our Latinx community, and then for some other communities, to make sure we're ingrained in building that trust. Because Dr. Smyser, when someone doesn't answer the call or doesn't answer the questions, then we lose that contact, and then it creates more community spread, which then could get higher numbers, and we could lose our variance, and we'd have to roll things back. So Katie, would you tell the group about your outreach group, efforts that you're doing?
Sure. So just like Dr. Smyser said, there's a huge focus on contact tracing, but a lot of that is around really our community trusting us when we call. It's a little unnerving to have somebody call you with health information. A lot of our folks didn't realize that we'd be calling. They didn't realize we'd have access to it. So lots of questions and concerns about that. It is a reportable communicable disease, so we get notified when it happens. We make contact with those individuals, but we really need cooperation, and we need people to understand that especially for our schools, the faster that we can get this accomplished and the more helpful and cooperative people are, the better off we'll be as a community. So we are hiring, we're in the process of hiring 2 outreach specialists focused on our community, really going out into neighborhoods, building rapport with businesses and kind of different aspects and industries within our community. And then we've specifically hired an outreach specialist for the Latinx community. Our Latinx population is much more impacted by COVID-19. Their case numbers are higher, and they often don't really understand the background of why we're calling. They're typically a little bit more nervous about us reaching out. So really trying to embed that outreach specialist in with those communities. They already have trusted sources. We've been working with the school districts and the libraries with already kind of existing relationship building, and we'll be embedding that outreach specialist, all of our outreach specialists, into those communities to help kind of explain and help our community understand kind of the importance, but also make sure that they understand that we're here to answer questions and concerns as well. Dr. Urbina, did you have something?
Yeah, great job, Katie and Tom. I just wanted to add for Dr. Smyser and the school folks and the community is that there's no on and off switch here. There's no safe or unsafe. You know, I think that the idea that we're having these tracking factors and data is very important to watch. You know, that we're going to have to be working very closely together so that as we see numbers rise, that we're going to be communicating and controlling the spread through isolation and quarantine orders, so that we're working together to make sure that we can make our schools and our communities as safe as possible. But we all, as we started out this discussion, we all have a role to play. We're with face coverings, washing our hands, we're eliminating large groups, responding to answering the call, are all important things that we all can do to make our community safer in Larimer County. And we all have a role to help our community as well as our schools be safe. So safer is our goal. And so I appreciate your efforts at the school system.
Thank you, guys. Commissioner Kefalas, it looks like we're running a little low on time. We did have one last question that was asked by Danielle. And Danielle, since we're running out of time, I'm going to forward that question to our school folks, and maybe they can respond to you via email. I have your email. It has to do with other school districts opening. But I think since we're running out of time here, Commissioner Kefalas, I know you wanted to talk a little bit here briefly about the next meeting and where that would be located and what the topic of that meeting was or is.
Yes. Thank you, Michelle. First of all, I want to thank my friends and colleagues from the Poudre School District, from the Larimer County Health Department. Certainly a lot of appreciation for you, Michelle, for hosting these virtual meetings. You know, folks are working really, really hard. It's a collaborative effort, and these monthly community conversations are my efforts, the county's efforts to be as accountable and transparent and to, you know, based on the issues that you folks determine are important to you. And that's what we've tried to do today. There's always opportunities for follow-up on this topic and any other topics that are most important to you. I do want to remind folks that the next meeting, I believe, is scheduled for Thursday, October 1, 7:30 to 9. We do have at least one person on the attendee roster that is from the Wellington Fire Protection District. And I know they have offered one of their fire stations. So that may be an option for the October 1st meeting. The topic will be the Wellington landfill. We have at least 2 folks from the solid waste department, the county solid waste department. So that's what we'll focus on. And again, respond to any other questions that people may have. In closing, let's see, I do also want to acknowledge that we have at least a couple of Wellington town trustees. So many thanks to them for participating, for listening. We have at least 2 Poudre School District board members, so thanks to them. And I believe Dan, the district representative for Senator Cory Gardner, is also one of the attendees. So in the end, we have to figure out ways to work together to address this issue and all the other issues that are facing our communities. So with that, I believe we're done. And as always, I wish you a good day, a healthy day, a safe day. And and of course, have if you're able to celebrate Labor Day, have a great Labor Day holiday. And I hope we can all take a little time, especially Katie, well, and Tom and Chris and everybody, to spend more time with family and kids. My granddaughter's in the next room, so that's where I'm heading in a moment. And I wish you all well, and please take care.